And welcome to The Chew. I'm James Carroll, and I'm here with the man himself, Dr. Drew Markham. Good morning, Doctor.
Good morning.
Nice to have you back, sir. Over the last few weeks, we've been talking about various myths, various fears, various financial commitments, and recently we've been getting a lot of questions sent our way, and of course in your office, myths that we need to clarify here.
Sure.
And I know because I've been looking at my little girl's mouth. Teeth are getting crowded in there, and is that because of wisdom teeth growing in, or what's the truth here?
That might be the most common question I get, certainly with teenagers, because that's the time when teeth are changing over and people are concerned about how they look and that sort of thing. And even in dental school, we were given that information that you might want to consider removing wisdom teeth to sort of prevent crowding. But the truth is, if you look at the research, people will have crowding whether they have wisdom teeth or not. And so the crowding is a result of the imbalance in forces, whether there's airway issues or other things like that going on. So the truth is that is actually a myth.
Because, this put in mind when I was in grade 8, I had all these big molars removed.
Yes.
So that my teeth would be perfect.
Yes.
And to this day, I still don't understand why.
Well, when you get into dental philosophy, I suppose,
there
are a number of different things that people think. And so for a long time, and even now still, some people will have teeth removed in order to create space to make them straight. And early in my career, I did that a few times as well. Knowing what I know now, I would never remove adult teeth in order to make teeth straight, because there's some other compromises that go along with that that just aren't worth it.
Now, let me ask you this. When do we know we have all our adult teeth in?
Well, you could take a dental anatomy class, I suppose, to know the difference between baby teeth and adult teeth. But the dentist will certainly know when the last ones are coming out. And once in a while, you'll have cases where the adult one has not formed. It's congenitally missing. And so it's good to identify that. So you want to take really good care of that baby tooth, because it might have to be there for another 60 or 70 years.
Well, it's funny you brought that up. Children's teeth, are they softer than the adult tooth that will eventually arrive?
No, the enamel that covers them is still the same. It may not be as thick. You may have, because the teeth are smaller, they can get into problems with, say, an abscess earlier than an adult tooth, and so there are some issues that way. But the enamel itself is still very hard.
Now, what's the expression? Milk teeth, is that what they call it?
Baby teeth are sometimes referred to as milk teeth.
And
yes.
That's just a euphemism?
Yes, and I can't remember the origin of it.
Right, and they're gone in a couple of years anyway, so...
Yes.
When people have issues with their gums, gum disease and things like that, before you treat them, those particular infections, they need to be treated with antibiotics. Is that true before you can treat them?
Again, this is where you can have different philosophies in terms of treatment. I went to dental school with a professor who was very much a proponent of the idea of giving antibiotics either before or during periodontal treatment. And there's a number of different adjuncts that can be used. Sometimes there are chips that are placed into pockets that have low-level antibiotics. There's beads. So there are a lot of different philosophies in terms of how to treat periodontal disease, because it is bacteria. But as of right now, you can add those things, but at the base, you still need to physically remove the bacteria. And so that's done with, scaling and ultrasonic instruments, and even lasers are being used frequently now to help basically kill the bacteria that are causing the damage.
So if you have an infection and you take the antibiotic, is that all you need to be doing?
Well, there's a couple of different scenarios where you would take antibiotics. Generally speaking, when I'm dealing with infections, you've got gum infections, like we've just acknowledged, that are usually chronic, where you can have antibiotics that help the treatment that you're doing. On the other hand, you can have tooth infections, which is like your more traditional abscess, where you're talking about either a root canal or removing the tooth. And that one comes up almost weekly, where you'll do an antibiotic to manage the bacteria and make the tooth feel better so you can treat it more comfortably. But then you have some people that disappear and say, well, the tooth was feeling better, so I figured it was okay. And the truth is that it will feel better, but the infection is still present. It's just not painful any longer.
Now, let me ask you about root canal, because I've had my share. When you go into the tooth, are you taking out nerve or?
Technically, yes. Most of the time when you're doing a root canal on a tooth, when you go into that canal, it's already dead. And so the nerve and the blood supply, when you see it in a healthy tooth, it looks almost like gum tissue. But very rarely do I come across that in doing a root canal because the infection has already progressed to the point where the inside of the tooth is empty. And often when you get into the middle of the tooth, there's that characteristic smell that, sort of is off-putting to the patient. It's like, oh, that's my mouth. But that's just the bacteria that's present that has a sulfuric gas that comes out.
Very lovely.
Yes.
And that is caused by, would we say poor dental hygiene, or just an accumulation of the sugars you talked about and bacteria that exist in our mouths to begin with?
By the time you get to an abscess, there are a few different routes that can happen. One is simply a cavity that gets very big and gets into where the nerve and the pulp is, and the body can't fight it off as well at that point. There are times where you can have cracks in teeth due to old fillings, those sorts of things. And those cracks will sometimes communicate with the pulp and lead to an abscess, and even trauma. A lot of time kids, when they go over the handlebars in their bike and they smash their front teeth, the teeth maybe don't break, but they might turn dark afterwards.
Right.
And from that trauma, that also leads to a death of the tissue inside.
Now, speaking of kids, you prefer to have the child in the chair with you or your assistant or whoever but not assistant, your dental hygienist.
Sure.
And maybe mom and dad should go and read a magazine.
Yes, and I'll explain that, because it's a very tough situation, because very, very often when parents are bringing their kids in, especially if they're having their first filling or something done and they might have freezing, the parents are remembering what it was like when they were a kid. And there's all kinds of horrible stories about how kids were treated back in the day, where they weren't frozen well, they were held down, they weren't acknowledged in terms of what was going on. And so parents carry those fears, and they don't want to see that happen to their kids, which makes total sense. The truth is, I have no issue with a parent watching over my shoulder to see what's being done, but often if the parents are nervous, the kids will pick up on that, and they'll start looking to mom and dad to sort of step in, because the truth is, if I had something to do on a Monday morning, it might not be going to have a filling done. So they have things that they would rather do, and sometimes they play on that.
Now, we've talked about this over the last number of weeks that we've been discussing this, is that dental styles, that chair-side manner, techniques have changed dramatically since I was a child.
Yes.
And, I know when my little girl goes to see her dentist, he's like a gentle bear.
Right.
And she doesn't mind going at all.
And the truth is that for most kids who don't have much dental experience, they don't know to expect the things that the parents think they should be expecting. So most of the time they come in there, they're wide open, they're watching TV, they're not really paying attention. We certainly take our time when we do freezing so that the kids, if they feel it at all, they barely feel it. And for the most part, we're able to really celebrate a great experience. And if I think it's going to be tough, I think it's really important to maybe take the parents out of the room to let them know what we expect. That sometimes kids will make noise. And I've been doing this for long enough that you can get a pretty good sense of when they're making noise because they don't like being there versus when they actually feel something. And I don't want kids to feel things, so
right.
I'll do extra freezing if I need to, and we pay close attention to that. But it's hard when parents don't know what to expect, so we try really hard to let them know ahead of time.
Yeah, and like a dad like myself, I hover, Dr. Drew, so I would be better waiting in the waiting room. Before we run out of time, there's a big event coming up next week, and I know that you are a participant as well as Hunters Bay Radio. The Rotary is
yes.
It's the Bathtub Derby.
Rotary Dock Fest.
That's right.
July 4th, Saturday. The parade is going down Main Street late morning with all the bathtubs and some dignitaries, and then we'll have races through the afternoon until about 3 o'clock. I just got the decals on my bathtub this weekend, so I hope everyone comes out to cheer mine out specifically, but also everyone else. It's a great free event for the family.
And will Dr. Drew be piloting the boat himself?
Oh, far too heavy for that.
Really?
Oh, yes. They're not the sturdiest of machines, and so I have Desiree, my hygienist, got her boater's license licensed just for this, and she's going to do great.
Well, good luck to Desiree. Dr. Drew, again, thank you for clearing up a few dental myths, and we'll be talking to you next week on
Sounds
The
great.
True with Dr. Drew.